Okay, today today we will start with the MCQ discussion of PSM, community medicine. And this subject is scheduled for three classes. Okay, three classes. So this is the first class. There will be more two classes. Okay. Okay, for the first question, father of public health is which disease? Tuberculosis, cholera, malaria, plague. Yes. Now, very important. First of all, this question is given like father of public health is which disease, but sometimes it came like in the FMG like this, father of who is father of public health, or which one of these following, or which option, which is father of public health. So like this also, three names will be given, three names of person, and one is the answer, because father of public health is not not a person, that is a disease. This you have to remember, and the answer is cholera. Father of public health is identified as cholera. Also there is John Snow, can be called as father of public health, but we go for cholera only. We say cholera is the father of public health. It's a disease, obviously. Now father of modern epidemiology is actually John Snow. He is actually the father of modern epidemiology and not public health. Father of medicine, first epidemiologist, true epidemiologist is Hippocrates. Hippocrates. Okay, very important. Although this today I will go with some questions which is quite easier and very direct, but PSM subject is like this, and these are very important because they directly comes in FMG. In the recent years also, this type of question came. These questions also came. Okay, very important. Next is PQLI. PQLI lies between 0 and 1, 0 and 10, 0 and 100, and 1 and 10. So answer is 0 and 10. What is PQLI? PQLI is the physical quality of life index. Physical quality of life index, and it comprises of, what are the components? Three components. Number one, literacy rate. Number two, infant mortality rate. Number three, life expectancy at 1 year. Okay, so these three are included. So questions also come like this. PQLI includes literacy rate, infant mortality rate, life expectancy at 1 year, the first year of birth, of age, or all of the above. Now, which one of the following is not included in PQLI? Another question can be like this. I am just going through some variants of the questions, and PQLI is a very important topic. So, which one of the following is not included in PQLI? Literacy rate, infant mortality rate, life expectancy at one first year, income. So, income is not included in PQLI. Again, HDI or Human Development Index comprises of literacy rate, which is also in PQLI, income, which is not at all in PQLI, and life expectancy at birth. Very important. LE at birth, or we call it LE0 actually. This is LE1 subscript. Okay, very important. In fact, this can also come. Which one of the which is PQLI? What are the components included in PQLI? Literacy rate, infant mortality rate, life expectancy at birth or LE0, both A and B. Literacy rate, infant mortality rate, LE0, both A and B. A, B, C, D. So answer is D. Both A and B, not C. Not C. C is life expectancy at birth is included in HDI. HDI, okay. Okay, this answer will not be 0 to 10, it will be 0 to 100, okay, not 0 to 10. Not 0 to 10, 0 to 100. PQLI lies between 0 and 100. 0 and 100. This is mistakenly bold. Okay, and HDI range is 0 to +1. 0 to +1. Value in India, PQLI 65 while HDI 0.547. 0.547. This is the value in India. Very important topic, and this difference is very important. Okay, next. Which of the following is true about HDI? Maternal mortality rate, infant mortality rate, life expectancy at birth, and at first year. So infant mortality rate was not there. Infant mortality rate is in the PQLI. And another is maternal mortality rate. MMR is not at all there. LE0, LE1, right? LE0, LE1. So which one of the following? LE0 is HDI. LE0, number C. Number C is the option, the answer. So literacy rate, income, LE0, or life expectancy at birth, denoted by LE0. Range is, always do remember, range is 0 plus 1, between 0 plus 1. And this is the value of HDI. This is the value of HDI, or HDI, simply said as HDI of India. India's HDI is 0.547. So next question, not included in PQLI. Income, literacy rate, literacy, life expectancy at first stage, infant mortality. So answer is income. Income is not included in the PQLI. PQLI includes literacy rate, infant mortality rate IMR, LE1, range is 0 and 100. Range is between 0 and 100, and value is 65 in India. Okay. Next question. An iceberg phenomenon with a value of 12 cases. Okay. Iceberg phenomenon is a value of 12 cases mentioned above the surface, 20 at the surface, 50 beneath the surface. Okay. So which disease has this pattern? Very important. Iceberg phenomenon is very important. So 12 cases mentioned above the surface, 20 at the surface, and 50 beneath the surface. 50 beneath the surface. So which disease has this following pattern? Okay. So answer is tuberculosis. Now iceberg phenomenon can be compared to a disease in a community. Floating tip of iceberg, that is visible portion, is the clinical cases that physician can see in the community. and it can be detected by diagnostic test, while submerged part or hidden portion are the latent one, undiagnosed cases, carriers, and detected by screening test by an epidemiologist. And water surface demarcation line between apparent and inapparent cases. So, how is the iceberg phenomenon? Okay, so this is the 12 cases. A, B, C. So this A is floating tip or clinical cases. And these patients can be easily detected by diagnostic tests. They have symptoms, they have signs, doctors can see, physicians can easily diagnose those cases by appropriate diagnostic test. Now tuberculosis, next is number B, that is demarcation line. This is between apparent and inapparent. Not the diagnostic test is not absolute. The result is not absolute. The result is not absolute, but we cannot tell them, or we cannot consider them completely submerged or latent cases or undiagnosed. But this is an C. We have diagnosed. We have understood that they have something, but we cannot come into a conclusive diagnosis. Then that is number B, or demarcation line. This. And C as the latent case, undiagnosed case, and carriers. All of them, and this is the water line, okay? All of them have the disease. All of them. They are clinically apparent disease, overt disease. They have covert disease, C for covert disease. And this portion is inconclusive, but that doesn't mean they don't have the disease. That doesn't mean they don't have the disease. They have the disease, but we can call them subclinical cases. And typical this phenomenon is shown by tuberculosis. Tuberculosis have some three types of cases. Overtly clinical. You can see these cases have overtly clinical cases. They have sinus clinical features. They have X-ray features. They have biochemical features positive. Okay. Next, there are subclinical cases. And a large portion, very large portion, is undiagnosed carrier latent covert cases, or we can say covert cases. Okay, so this is tuberculosis. Now, iceberg phenomenon is not shown by rabies, tetanus, measles, rubella. You cannot see measles patients to be subclinical or latent carriers. All these three portions are present. No, that will not happen with measles. Okay. Okay. Next question. Changes in the occurrence of the disease over a long period of time. Changes in occurrence of a disease over a long period of time is secular trend, cyclical trend, seasonal trend, epidemic trend, and the answer is secular trend. So what are these first of all? These are time distribution of disease. These are time distribution of disease. Number 1, secular trend. Number 2, cyclic trend. Number 3, seasonal trend. Okay. Secular trend means it implies changes in occurrence of a disease over a long period of time, generally several years or decade. So secular is occurrence of disease when the occurrence of a disease or occurrence of a disease occurs over long period of time, or distributes over a long period of time, then only we call it secular trend. So long period of time, maybe several years or decade. For example, diabetes mellitus, obesity, hypertension, polio, diphtheria, pertussis are the conventional ones, and newer disease like recent type of disease like diabetes mellitus, obesity, hypertension. These type of disease you cannot see that 2 days, 3 days before it occurred, and within few days or like 1 week or 1.5 week, by half week, 1.5 week, it just resolved. It will not happen like that. It will go on for several years, maybe decades. Okay, so this is called secular trend, the trend of the disease, the timing of the disease, how much time it is present, or what is the timing characteristics of the disease. We will go next. Number 2, is cyclical trend. Cyclical trend, what happens, some diseases occur in cycles, spreads over a period of time, which means days or weeks or months or years, and non-infectious conditions may show periodic fluctuations, like automobile accidents in the US are more frequent on weekends, especially Saturday. Now, other examples are measles occurring every 2 to 2 years, rubella occurring every 6 to 9 years. So this is also comes under the trends. Every 2 to 3 years, you can see measles fluctuating or elevating up. There will be in more number of cases of measles every up to 2 to 3 years. This is a trend of measles. Okay, so it occurs in cycles, or occurs, or increases in cyclical manner. Okay, every 2 to 3 years it increases. Influenza also has 8 to 9 years, almost 8 to 9 years. Sometimes you can see bird flu, sometimes you can see influenza virus, influenza. Okay, so this type of this also comes in this cyclical trends. Another is seasonal trends, that is according to the seasonal variation. That is seasonal trend according to seasons, not seasons, seasonal variation, we can say. Like measles also. So measles can come under cyclical trends, can also come under seasonal trend. GIT infections in summer, in rainy season, more GIT infections, seasonal variation and fluctuation in the occurrence of the disease. During the rainy season, during the summer season, we have we can see more and more GIT infection. That is seasonal trend. So the trend of the disease, like according to the trend, we eat food, we wear clothes, like ice cream, a seasonal food, mostly in summer. Okay, we go for ice cream, we eat ice cream, but not in winter season, we likely to avoid, or the sales of ice cream decreases in winter season. So like that only, these diseases are associated with the in a timing manner. Okay, but secular trend is not the occurrence, but it occurs for the whole duration, a long duration, for the long period of time. It occurs for the long period of time. In fact, we are not, while explaining, while studying the secular trend, we are not talking about occurrence of the disease in a particular time of a year, but we're talking about that this type of diseases goes on for years and years, goes on for years after years, maybe decades, like diabetes mellitus, like obesity, like hypertension. In fact, they do not go and come on, there is no fluctuations in them. They stay for a very, very long time. In fact, throughout the life. Okay, so this is about the trend of disease. Next question: which of the following defines the ability of an organism to cause infection? Pathogenicity, infectivity, antigenicity, virulence. So the answer is infectivity. Now, three things: infectivity, pathogenicity, virulence. What are these three things? Infectivity is the ability of an infectious agent to invade and multiply. So two things: invade and multiply, producing the infections in a host. So basically, ability to invade and multiply. Next is pathogenicity, is the ability to induce clinical apparent illness, or we can say clinical symptoms. So induce, the ability to induce pathologic reactions. So, or we can say clinical features. Virulence. Virulence, proportion of clinical cases resulting in severe clinical manifestation. So, proportion of clinical cases, that means strength. This is induce, whether it can induce or not. Yes or no. Now, how much? Same thing, but the question is how much. Here, whether yes or no. If yes, if pathogenicity is positive, then the question arises regarding virulence. How much? If it is no, then no question of virulence. If a given or a particular infectious agent has no pathogenicity, there is no question of virulence. We will not ask about how much. If an infectious agent, if a particular infectious agent is pathogenic, then only we will ask about how much or how much virulent. That is the concept of virulence, pathogenicity. And infectivity is the first thing, whether the infectious agent can invade and multiply. Can invade or not? First of all, invade actually. First of all, invade and then multiply. This invasion can occur through respiratory tract, through ingestion, through skins, anywhere. Okay. So these are the three important terminology. Okay. So next, another thing is antigenicity. Actually, antigenicity means the ability to act, as antigen, or we can say the ability to induce immunological reactions, or the ability to induce the manufacture of antibodies, that is antigenicity. Okay, so different terminologies with different significance. Okay, next question. In ICD-10, ICD-10, how many volumes are there? 1, 2, 3, 4. 3. ICD-10 is International Classification of Diseases, 10th revision on January 1st, 1993. So it does not uniform. ICD does uniform classification of diseases which can be used throughout the world to make accurate comparison of morbidity and mortality data for decision making in prevention, facilitation, and management of healthcare system. Now ICD-10 consists of 3 volumes. Volume number 1 contains reports of International Conference of 10th Revisions, classification of morphology of neoplasms, special tabulations list for mortality and morbidity, definition and nomenclature regulations. Volume 2 instruction manual, volume 3 alphabetical index. So anyway, you need to know for FMG what is ICD-10, how many volumes are there, another thing is there how many major chapters are there. These are the important points for FMG. And ICD-10, 10th is the 10th revision, okay? So that is the important thing. Okay, next question, what is the true about double blind? Patient getting double treatment. Patient does not know that he is a part of clinical trial. Patient is getting both placebo and medications, and patient does not know what is he getting. The answer is last one. Patient does not know what he is getting. Double blind. So first of all, this terminology comes in clinical trial. Clinical trial. Now, in the double blind trial, what happens? Neither the patient nor the doctor or the investigator are aware of the group or aware of those patients who are allocated in which group and the treatment received. Patient is either getting placebo or the drugs. For example, a patient A coming to the investigator, neither the patient nor the investigator know this patient, whether this patient belongs to placebo group or the drug receiving group. So investigator also doesn't know, patient also doesn't know where he belongs. That is double blind. All the clinical trials must take an informed consent regarding the same from the participants. So first of all, very important point for clinical trial is informed consent. And next is single blind trial. It is planned in such a way that participant is not aware whether he is belong to the study group of the control group, but the investigator knows here. Investigator knows. That is single blind trial. Double blind trial, just now we discussed, both the patient and investigator or the doctor are unaware what is going on. From which group, whether placebo or control, placebo is the control, placebo or the drug group, from which group a particular patient is coming from, whether he is receiving the newly made drug for which this clinical trial is going on. It can be drug, it can be vaccine, it can be a new machine as well. So whether the particular patient is coming from the drug group or the placebo or control group, or we can say it's study group for which it is the study is being done. Study is being done. Okay, so that is the study group or control group. So double blind trial, patient and investigator, both of them doesn't know. So both do not know what is going on. Triple blind. In this trial, the participant, investigator, and the person analyzing the data are all blind. They are not aware. So the participant plus the investigator plus the analyzer. So double blinding is most commonly used method when blind trial is conducted. And this is what? These are bias. These are bias. Because why these are bias? Now what happens is that while studying a new drug or new disease or new whatever medical device, what happens that if the investigator knows the patient personally, sometimes biasness occurs in case of questionnaire while taking the questionnaire from the patient during the study time. So for that, to mitigate this, to minimize this effect of biasness and to carry out or to extract the real data, real facts, these blind trial are conducted. If the investigator knows only patient is unaware, then it is single blind. Both the investigator and patient is unaware, then it is double blind. And all of the patient, investigator, and analyzer, all of them are unaware, then it is triple blind. But this is most commonly used. Okay, so this is about bias, actually, clinical bias of clinical trials. Okay, very important topic. This is also. Okay, next is randomization. It brings bias in study group, therefore avoided. It is the procedure by which participants are allocated into groups, usually called study group and control group. It ensures that investigator has full control over allocation of participants to study or control group. It is done usually before entering in the study, and then consent is taken. So what is randomization? Randomization is the procedure by which participants are allocated into groups, usually called study or control group. Randomizedly, they are allocated. So randomization is the heart of control trial. It is a statistical procedure by which the participants are allocated into the groups, usually called study and control group. It is an attempt to eliminate the bias and allow comparability. If the investigator knows the patient personally or becomes personal at any stage, what happens? Maybe the investigator may allocate the patient to the placebo group or to the study group knowingly or for a reason, not for the good of the study. So this causes biasness. So randomization is employed that randomly these patients or these not patients, these participants are allocated to any one of this group. By doing this, it is ensured that investigator has no control over the allocation of the participants to study or control group, and this removes which bias? Selection bias. Another important question comes here for FMGE. Randomization removes which bias? Do you remember? Selection bias. Which bias? Selection bias. Very important. Randomization is done only after the participant has entered the study, that is after having been qualified for the trial and has given his informed consent to participate in this study, obviously not before that. Okay, next question. Primordial preventions means very important, because questions quite frequently comes in FMG, quite frequently from this prevention. So primordial prevention means preventive action taken prior to the onset of disease, prevention of emergence of risk factors of the disease, prevention of disease from causing complications, early detection of disease by screening. And the answer is prevention of emergence of risk factors of disease. So we'll talk about the preventions, very important. So primordial prevention is what? Primordial prevention refers to the prevention of development of the risk factors in countries or population groups where they are yet to appear. That means still the risk factors has not appeared. Risk factors have not appeared. Best example in current setting is obesity. Prevention of obesity. Now, obesity is a risk factor for many things, many diseases, and very common are hypertension, diabetes, all these things. There are many. There are many basically. Cardiovascular diseases, other cardiovascular diseases, atherosclerosis, etc. Now, obesity is a very big and important risk factor. So prevention of the obesity is, if prevention of obesity is done in a country by controlling foods, by controlling the dietary behaviors, dietary habit of the children, that means that program is primordial prevention, because by doing so they are preventing the emergence of the risk factor that is obesity in this case, which can lead to other disease. So primordial prevention. Now, for instance, adult health problems like obesity, like hypertension, take root in childhood when lifestyles like smoking, eating patterns, physical exercise are formed. As part of primordial prevention, efforts are made to discourage high-risk children, adolescents, and young adults from adopting harmful lifestyles. The primary intervention is through individual and mass education. That means basically education or awareness program. Education through awareness program and all. Okay, so this is primordial prevention. Okay, next question. Immunization is which type of prevention? Primordial, primary, secondary, tertiary. Immunization is which type of prevention? And the answer will be primary. Why? Because immunization, you see, the first thing, obesity, when we're talking about primordial prevention and prevention of obesity, in that prevention of obesity can give you a good life. In one line or as a conclusion, we can tell a good life, because obesity is such a state, it can not only prevent the causation of hypertension or diabetes or cardiovascular disease, but also it can lead to a very problematic life, including there will be, the obese person has problem in everything, from eating problem, from sleeping problem, from movements, from hygienic problems, from anything and everything. There will be lots of problem. So primordial prevention refers to prevention of risk factors, or we can say prevention of harmful conditions. In very general term, harmful condition. While we talk about primordial prevention, we do not talk about any specific prevention or prevention against a specific disease like measles, like rabies. No, not. Primordial prevention talks about an overall prevention of overall harmful or problematic lifestyle, problematic condition. But in case of primary prevention, like immunization is a primary prevention. It is immunization. Always remember, immunization means vaccines, right? Vaccines. This immunization or vaccines, they are specific protection. They provide protection against a specific disease, a specific condition. So that is primary prevention. But things to be remembered that it is given to a healthy person. Primordial, obviously, to a healthy person. All the persons, a healthy person will receive that primordial prevention, and also primordial prevention. And for primary prevention also, they are given to healthy person and not to a patient. Okay, another thing is that, like, iron tablets. So other examples of some specific protection. Other examples of specific protections are like IFA tablets, that's iron tablets with folic acid, given to pregnant women. Why? Iron for the pregnant woman, and especially folic acid to prevent NTD of the fetus. Then iodinated salt in goiter. This is also just preventing goiter. So providing iodinated salt in order to prevent goiter. So specific disease against a specific, that is primary prevention. Very important, we must talk about the exceptions. BCG vaccine, though it is a vaccine, it is also given for treatment of bladder cancer, and that is why that is secondary level of prevention. We'll talk about all the levels. Now there are 4 levels of prevention. Very important topic, very important topic for FMGE. Primordial preventions like preserving traditional lifestyles, not traditional, basically preserving the harmless lifestyles, not those harmful, luxurious and harmful, both. Not all luxurious lifestyles are harmful, but luxurious and harmful lifestyles, including smoking, including having consumption of alcohol too much, then consumption of saturated fats, trans oil, trans fat, all this. These are primordial preventions. Then sedentary lifestyle. Preventing sedentary lifestyle is primordial prevention. Okay, because from obesity there can be a lot of disease, including skeletal musculoskeletal diseases as well, from liver diseases, from GIT disorders, cardiovascular, everything, diabetes mellitus, and you can see diabetes can affect a lot of organs. Next is primary prevention. Here the risk factors already started, but there is no disease. So mode of prevention will be health promotion and specific protections, and this specific protection pertains to vaccination. Like once polio program used to be there, now it is almost came to a halt because polio is quite absent now. So all the children under 5 years used to be given polio vaccine, because all the children is thought to have the risk factors to get polio virus. But before having the disease, those specific protection are given. That is primary prevention. So all vaccines comes under this, contraceptives comes under this, mosquito nets comes under this, chemoprophylaxis also comes under primary prevention. Although the disease is not there, but we provide some kind of prevention in order to prevent a particular disease. Next is secondary prevention. When disease has probably started, if disease starts, then something is given, some preventions, or something is done in order to remove the disease, then that is secondary prevention, and that can include many things. That can include screening and diagnostic tests, treatment measures, BP monitoring, early diagnosis and treatment. For example, I'm taking a very recent and very important topic, important risk factors, especially obesity. For example, a boy is healthy, not obese. Primordial prevention is that if that healthy boy is given advised not to go for harmful lifestyles, not to eat saturated fats, trans fats, alcohol, smoking, that is primordial prevention. But the boy did everything and the risk factor is present. That means obesity started. Now when the risk factor is present, that is obesity started. Now the boy is given some specific protection. For example, against hypertension. Against hypertension. Some specific protection like some stress releasing exercises, good foods, healthy foods, avoiding oils, all these things. Just to avoid, just to prevent a particular disease. That is, we're talking about cardiovascular disease, hypertension, maybe. Just an example, along with this. Now, suddenly not one day, and suddenly it has been found that boy's BP has increased. But we cannot say hypertension. BP has increased. Elevated BP. Elevated BP more than 120 by more than 80. 120 by 80. More than. Be not grade 1 hypertension, but elevated. Then what we will do? Secondary prevention, and that will include BP monitoring. So continuous monitoring or regular monitoring of BP. That will be the secondary prevention. Tertiary prevention will be, and one day and another day, not day, I mean slowly, the boy diagnosed with hypertension. Actually, here only hypertension can occur because it includes treatment measures. So treatment, regular monitoring and treatment means drugs. Hypertension drugs will be started. Now, if the boy had, or not anymore boy, maybe he became man, and if that man has heart failure or myocardial infarction, then myocardial infarction and became completely, bedridden or few not efficient as before, then we will go for rehabilitation. That will be tertiary. So after disease has already started progressing or progressed a lot. So drug and treatment measures comes in the secondary when we already diagnose the disease. Elevated BP, start drug, or hypertension. If hypertension becomes evident, then also this secondary prevention. And tertiary is after having after disease made the particular person weak or anyhow inefficient or disable, then we go for tertiary prevention. That is minimizing the disability and rehabilitation. So you must understand these concepts very, very clearly because they change the examples and ask which type of prevention is this. That is the problem. That is the problem that you need to understand, not the direct question like this one will come. Oh, one. Okay, not this only one immunization in which type of prevention. Not only this one will come. This is very important actually, and this has already come in FMG immunization. But they can give you mosquito net out of these examples also they can give. But the thing is, in FMG they can change the concepts, they can change the examples, they can ask you. All the screening and diagnostic tests comes under secondary prevention. They can simply gives an example and can ask which level of prevention. Okay, so that is to the concepts has to be understood very well. Okay, next question: screening of cervical cancer. Obviously, secondary, as I told you, the screening tests, all screening tests are secondary. Screening and diagnostic secondary. All screening and diagnostic tests and treatment measures comes under secondary level of preventions. Okay, next, all of the following comes under primary preventions except pap smear, helmets. Helmets means those wears during driving a bike. Helmets. Contraceptions, vaccinations. Except. So pap smear, helmets, contraception, and vaccination. So what is vaccination? Vaccination is primary. So that is primary only. Contraceptions. Contraceptives are also primary. Is like this. Primary. Helmets and pap smear. Let's see. Pap smear is not primary. Primary is the action taken prior to the onset of the disease, which removes the possibilities of disease occurrence. But in primary prevention, what happens? Risk factors is present. Risk factor is positive, like obesity is positive. Pap smear is basically a screening test, right? Pap smear are basically a screening test, and it comes under secondary. It comes under secondary. And helmets are used in for prevention of road accidents. Now, road accidents is also considered as disease here. Okay, that is artificial disease, not the biological one. Now, pap smear. Now, helmets are given to them who drives two-wheelers. So basically, in that case, risk factors is present, but accident has not occurred yet, but risk factors is present. That is, risk factors is driving two-wheelers. Driving two-wheelers. That is the risk factor. That is why helmets are used. So primary prevention. This is also primary level of prevention. Very important. Why important? Because it has to be clicked in during the exam time. Okay, so this is about pap smear. Okay, next question. Decks provided with a tabletop to prevent neck problems is an example of primary, specific protection, disability limitation. Specific protection. Why? Because it has specified, you see, neck problems. Neck problems. It cannot be any other. Neck problems. They have not told that to prevent any disease or prevent harmful conditions. No, not like that. Specific prevention has been considered here. Specific prevention of neck problem before the onset of the disease, and decks provided with the tabletop probably decrease the risk of developing neck problems like cervical spondylosis. This is the primary level of prevention done by specific protection. This is the primary level of prevention done by specific protection. Okay, next. Which of the following set is termed as epidemiological triad? Very, very important, but very easy as well. That is agent, host, and environment. A broad concept of disease causation that synthesized the basic factors of agent, host, and environment. And this image has been given. Especially, this epidemiological triad corresponds with an infectious disease, because otherwise agent, you see, agent, host. Okay, so that's the thing. And another factor has been incorporated, that is modern epidemiological triad includes time as the fourth factor. You have to remember that also. So if there is agent, host, and environment, and time as any of these options, so you can go for it also. Okay. First case which comes to the notice of investigator is called as initial case, primary, secondary, index. The answer will be index. Index case is the first case, is the case that is the first case of a disease in a group seen by an investigator. Seen by an investigator is an important term, an important point, or which brought to the attention of the clinicians and not always the primary one. And the primary is the first case of communicable disease introduced into the population unit being studied. Secondary, all cases who develop from primary cases, incubation, entry of organism till symptoms, incubation period, and median incubation is the time period for 50% cases to occur. The time period for it, that is the median time, median incubation period. So the primary case is the first case of the communicable disease introduced into the population. But not the index case. Index case is the first case that is caught by the investigator, that is presented to the investigator, or the case that has drawn attention of the clinician. That is the index case. So basically, index case comes under secondary case, because primary one is the primary case. In fact, nobody knows about it. In fact, not the investigator or the clinician. Then secondary cases started due to spreading secondary cases. And out of secondary cases, one got the attention of the investigator or clinician. That is termed as index case. That is termed as index case. Indexed means recorded. So the first record case, index case. Okay. Quarantine. Quarantine is separation for the period of communicability of infected persons from others. Limitation of freedom of movement of well person or healthy, actually of well person means healthy person or animals to the incubation period of disease. Identification of source of infections and factors influencing its spread in community. Notification of disease to local health authority to put control measures on it. And the answer is limitation of freedom. Limitation of movements of a healthy person till the incubation period of the disease. That is quarantine. Quarantine is defined as the limitation of movement of such healthy person or domestic animals, whoever in question, who are exposed to communicable disease, any infectious disease, for a longer period of time and not longer than the longest usual incubation period of the disease. This effectively prevents the contact with those who are not exposed, thereby reduces the chances of transmission, cutting off the transmission. Because if transmission is not cut off, then what will happen? The person from whom the agent came, it will resolve in that person, but a new person will be infected. So in this way, it will form a chain. So to quarantine basically cuts off this chain. Okay. Next is isolation. What is isolation? Isolation is separation for the period of communicability of the infected person. This is quarantine is done for done up to incubation period time. This is very important point. And isolation is done for period of communicability. Of infected persons or animals from others in order to reduce direct or indirect transmission. Next is epidemiological investigations, identification of source of infections and factors influencing its spread in community. And notification of an infectious disease to local health authority to put control measures on it. That is notification. Okay. So these are some of the terms. Okay. Disease in all of the world is endemic, epidemic, pandemic, sporadic, and the answer will be pandemic. So what is endemic? Endemic is constant presence of a disease or an infectious agent within a given geographical area or population group. That's endemic. Like tuberculosis in India. It's endemic. Constant presence of a disease or an infectious agent within a given geographical area. Epidemic. Sudden occurrence and the rise of particular health-related behavior or event which is the excess of expected occurrence. That is epidemic. Sudden occurrence and rise of particular health-related behavior or event which is in excess of expected occurrence. Now these definitions are why important? Because always this type of questions will not come. They will even, in fact, they will ask like this: epidemic is constant presence of disease or infectious agent within a given geographical area, sudden occurrence or rise of particular health, and they will change a little bit. And you will see this type of sentence, sudden occurrence and rise of particular health related behavior or event which is in excess of expected occurrence. This will be, for example, this is number B, this sentence. Another sentence is number C, sudden occurrence and rise of particular health related behavior event which has not reached its expected occurrence. So obviously not C. B will be the answer, but both of them will look similar very grossly. If you look at them, they will look similar. So in PSM, what happens? These are the problems that they sometimes give tricky questions, and that makes the problem very easy. Questions become difficult, and there are lots of questions in PSM from PSM. Lots of questions in paper 1 also and paper 2 also. That's why, although these are easy, you have to be very, very specific about the definitions. Like sudden occurrence and rise of particular health related behavior or event, which is in excess of expected occurrence. Very important. Epidemic occurs when the number of cases exceed. Again, a very important point. Number of cases exceed twice the standard deviation of the natural expectancy. That means natural expectancy. Or natural expectancy can be said as mean. That is epidemic. Sporadic. Scattered cases which occur irregularly, haphazardly, from time to time. So basically, scattered cases, these cases are very few and separated widely in space and time. And they show little or no connection with each other, not a recognizable common source of infections. For example, a case of influenza in January in some places like in Delhi, or another again influenza of the same kind like in March or April, but from, for example, from Hyderabad. Both of these cases never have they have met each other, not they came from the same place or they have traveled to same places. So no connections, scattered cases, scattered by place, scattered by time, no connections, sporadic cases. We call it sporadic cases. Pandemic. An epidemic usually affecting a large proportion of population, more than a country, many countries, maybe a continent, occurring over a wide geographical area like section of the nation, the internation, a continent, or the world. So basically, the word pandemic refers to a large geographical section. It can be a section of the nation also, like West India, like Eastern India. For example, influenza going in the north and northeastern part of India. Pandemic occurring in north and northeastern part. It can be whole India, it can be whole Asia, it can be the whole world. Like in 2020. So this type of thing. This is pandemic. So very, very important. You need to remember the definitions and the very minute details. That is very important. Okay. Point source epidemic is gradual rise and gradual fall in the number of cases. Sharp rise and sharp fall in the number of cases. Sharp rise and fall is interrupted by secondary waves. Gradual rise and fall is interrupted by secondary waves. So point source epidemic. Point source epidemic is sharp rise and sharp fall in number of cases. Basically, what happens in a point source? For example, it can be well understood by a good example, like in from a shop, if 50 customers bought foods or have eaten food, out of 50 customers, like 22 customers had GIT upset, and that occurred in the last Sunday. So at certain point, particular day, from a particular shop, particular day, suddenly 22 cases of GIT upset, vomiting, nausea, and abdominal pain. But we are not sure what is it, so we're not going for any particular disease or like that. GIT upset with vomiting, nausea, and abdominal pain. So the shop was closed for a week. And the cases came down within Tuesday or Wednesday or tomorrow. It came down. I mean Tuesday and Wednesday. So starting from Sunday, everything resolved within Wednesday, and no more cases, zero. That is point source epidemic. So point source epidemic or single exposure epidemics, sharp rise and sharp fall in number of cases, clustering of cases in narrow spectrum of time, like Sunday to Wednesday, as from our example. Sunday to Wednesday, very short span, narrow spectrum of time. These are very important because the questions will come, all are true about points. So this question may not come. This is a very easy question and have already come a lot of time actually. Point source epidemic is, but it may come, you must know. But question may come like this: which one of the following is false about point source epidemic? Sharp rise and slow falling in number of. Which of the following is maybe which of the following is false about? Okay, false. Then sharp rise and sharp fall in number of cases occurs in a wide spectrum of time, which is false actually. It should be narrow spectrum of time. All cases develop within one incubation period. None of this. So the option B, narrow spectrum of time, not wide. So you must remember the correct options actually. So must know each and every point meticulously. Although they look very easy, but sometimes what happens, the questions is the problem, because as a whole they are very easy. Who doesn't know about point source epidemic? But the question they will give and the options they will give, that will make the student to give wrong answer. Okay, so that is why meticulously all the each and every point must be remembered very meticulously, like narrow spectrum of time, like all cases develop within one incubation period of disease only. Next is common source, continuous or repeated exposure epidemics. Sharp rise in number of cases, fall in number of cases is interrupted by secondary waves or peaks. This is different. So this is number one, this is number two. Example, contaminated well in a village, sex worker in a gonorrhea outbreak. Fall in number of cases will be interrupted by the secondary waves. This is continuous or repeated exposure. What happened? In this example, you see point source. No secondary waves. No secondary waves. Why? Because after the incident of on Sunday, the shop was closed. Shop was not allowed. Shop was not allowed to operate and distribute or sell is bad quality foods. But if the shop was allowed to do so, what would happen? On Tuesday, again another wave would have come. And that would become from point source to common source. Continuous source. Again, there will be, so what happens? So Sunday this happened. Okay, Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, like this. So Sunday happened, Monday, Tuesday again happened, again Wednesday again happened. So it's a continuous source because the shop is not closed, and that's why it continuously distributes, goes on distributing. But is not controlled. When the number of cases are coming, and the shop is selling bad quality foods, leading to secondary wave. Again 20 people, again 25 people are getting sick, again 23 people are getting sick. Like this continuous source of repeated exposure. Very good example. That's common source. Propagated. Number 3. Gradual rise and gradual fall over a long period of time. Results from person to person transmission. Results from person to person transmission. results from person to person transmission. So it propagates. Transmission continues till the number of susceptibles or who are having the risk factors are all having the disease. And they are no longer exposed to infected, or they are no longer exposed to infected individuals. So either all the susceptibles are already exposed and having the disease, or they are no longer exposed to the infected individuals, and this person to person transmission is cut off. So until then, transmission continues. So propagated epidemics. From person to person, this epidemic will propagate, move. So it can be stopped by either by when all the susceptibles are infected, or it may get cut off due to unavailability of contact between two susceptibles. Okay, that is propagated epidemics like HIV, like tuberculosis. Next, endemic is constant presence of disease in a defined geographical area. As we have already studied, pandemic is epidemic affecting a population occurring over a large geographical area. It can be a part of the country, it can be the entire country, it can be the more than a country, continent, or the whole world. Sporadic is a scattered cases. They are widely separated in space and time and shows little or no connections. Okay. Period between infected host to appearance of the symptoms. Period between infected host to appearance of symptom is called generation time, serial interval, communicable period, latent period. The answer is generation time. Generation time is the interval between receipt of infections by a host and a maximal infectivity of the host. That is called generation time, incubation period. Serial interval, the gap in time between the onset, the primary case and the secondary case is called serial interval. Gap in time between the onset of the primary and secondary case, that is serial interval. So generation time is the interval of time between the receipt of the infection by a host and the maximal infectivity. So okay, let's draw it. Receipt of infection, receiving the infection, and reaching the maximal infectivity. Producing what? Producing symptoms actually. This is generation time. Okay. Next, from primary case then to secondary case. This is the primary. So the primary case has started. Now primary to secondary case propagation. So this was this was all about primary case. Primary case receiving the infection and then having maximal infectivity. Then the primary case is propagating to secondary case, and the time period is called serial interval. Then a communicable period, time during which an infectious agent may be transferred directly or indirectly from an infected person to another person, from an infected animal to a person, or vice versa, including arthropods. This is the communicable period. Now, this is one type. For example, a patient time during which an infection may be transferred directly or indirectly from infected person to another person. So the communicable period, no need to draw a graph because the ability of the patient to transfer the agent a causative agent to another person during the period of that ability. That is communicable period. And latent is period from disease initiation to diagnosis or detection. It's the latent period. Although the patient has the disease, it's not diagnosed yet. That's the latent. Lead time. Time from early diagnosis to starting of the treatment. Time from treatment to mortality. Time between detection disease through screening and its clinical symptoms. Time between clinical symptoms to complete treatment. And the answer is time between detection of disease through screening and its clinical symptoms. Detection of the disease through screening and its clinical symptoms. So lead time is the length of time between detection of disease and its usual clinical presentation and diagnosis, or it is the time between early diagnosis with screening and when diagnosis would have been made without screening. See, in the graph, in this diagram, what we can see, onset of the cancer. Cancer is detected through screening. And this is the cancer detected through symptoms. Symptoms started. So this is the lead time. Time between the detection of disease through screening and its clinical symptoms. When cancer was detected through screening, there was no symptom. Symptoms appears when the disease becomes sufficiently enough, or the disease causation becomes sufficiently enough to produce an apparent clinical feature. Otherwise, there will be no apparent disease or apparent features. So that is lead time. Next, this is the survival time. This is the survival time with the symptoms up to the outcome. Outcome can be many things. For this cancer onset, they have written death. It can be resolved. It can be partially resolved. Partially resolved means resolved with disabilities or permanent disabilities. Permanent disability. Or death. So any one of this. Okay. So must remember what is lead time, what is the survival time. All the whole story must be remembered very, very clearly, because they can even give this IBQ. They can give these IBQ. They can ask this. They can simply. They can just ask the time. What is this called? Number A. So they will ask, what is this point number A? And there will be nothing written here. Survival time, perceived survival time, detection of symptoms, cancer detection, and lead time. So you need to answer lead time. These are the real-time questions I'm telling you. Real-time questions. These are very important questions. They have a high chance and probability. This type of questions comes in FMG. This type of question comes in FMG. So the whole image has to be should be very clear to you, very clear. Lead time and perceived time and survival time, anything. Okay, next. Number of live birth per 1,000 women in reproductive age is net reproductive rate, total fertility rate, gross reproduction rate, and general fertility rate. So the answer is general fertility rate. Number of live birth per 1,000 women in reproductive age. Now let's see one by one. First of all, net reproductive rate. It's the total number of girl children born to a female. Total number of girl children born to a female, taking into account their mortality. So basically, for example, if a female had 10 live birth of female child or female children, out of which two died at the time of birth, then net NPR, not in NPR, we cannot say NPR because we have to divide by 1,000 women. Anyway, net is 8 girl children born. So this shows what? This shows one female mother means female, is replaced by 8 females. This is a very, very important indicator of our future demographics. Those 8 females will have the ability to produce more babies, and so we can predict what is going to happen or what can be the status of our demographics. So very important indicator. Next, total fertility rate. Total fertility rate, average number of children born to a woman in a reproductive lifespan. Average number of children means, for example, if we consider 10 mother or 10 women, then average number of children born to a woman in a reproductive lifespan. So we need to find out what is the average number in the whole reproductive lifespan. That is total rate of fertility. Next is gross reproduction rate. The total number of girl children born to a female, which is half of the total fertility rate. That is the gross reproduction rate. Now see gross reproduction rate and net reproduction rate. Net reproduction difference is net reproduction rate. We considered how many are dead, how many died during the time of birth. Birth was live birth. There were 10 live birth, but out of which 2 died during the birth only, just right after the birth. That's why 8. That is net reproductive rate. But in case of gross reproductive rate, we will consider the number 10 live birth. It's gross reproductive rate. General fertility rate. Is the annual number of live births. Annual number of live births per 1,000 married women of childbearing age. General fertility rate is the annual number of live births per 1,000 married women of childbearing age. 15 to 49 will be the span. That is general fertility rate. Number of live birth per 1,000 women in the childbearing age. Total number of live birth doesn't account for girl child or boy child or nothing. Both boys and girls. Next question. Maternal mortality rate is expressed as 1,000 live births, 100,000 live births, 1,000 pregnancies, 100 pregnancies, and the answer is 100,000. 100,000 or 1 lakh. So MMR is expressed as 1 lakh live birth. You must know that it is a ratio. Most common cause of MMR in India is postpartum, not the postpartum hemorrhage. Very, very important point. Most common direct cause of MMR, again PPH, most common direct cause. Most common indirect cause of MMR is anemia. Actually, anemia occurred. From there, maternal death of mother, maternal death occurred. Actually, anemia was the underlying pre-existing conditions during pregnancy, whole pregnancy, and after during lactation also. So maternal death is the death of a mother. Very important. What is maternal death? Death of a mother anytime during pregnancy, labor, or within 42 days of termination of pregnancy. That is called maternal death. Maternal death is during the time the woman or the pregnant mother bearing her child. Number one condition. Number two condition, having labor. Having labor. It's another condition. Only these two conditions. That is only maternal death. And if pregnancy is terminated in 42 days after pregnancy, that will be counted as maternal death. Now the formula is again very important and maybe coming in FMG also. So you must remember the formula also. Number of maternal death in a given year by total number of live births in the same year. They will simply change into 1 lakh, into 1 lakh live births, like 1,000 live births, 1,000 pregnancies. They can change like the options given, or they can change the denominations, number of live births, or they can tell number of total birth, live plus death during labor. In the same year, in the average total number of span of 10 years, they can change in this way. Just they can make all different options, but the real option, the actual option will be one, and you must remember the correct option. If you know the correct answer, just focus on the correct answer and just pick it, because there will be no such case or clinical questions. All questions are clinical only. Cases or story based case will not be coming from a PSM. From PSM there will be lots of questions, minimum of 30-35 questions, and all will be like this type of questions, or 1-line 2-line questions will be. It will be, and you must remember all the facts, very much fact based, and you have to be very sure about those facts, because they will change little bit. Everything they will change. Like MMR is a ratio, is a percent, is some other numbers, percentile, simple questions. But you must remember that MMR is a ratio. MMR is expressed as 1 lakh live births, not 1,000 live births. No. Okay. Which of the following is true about cohort study? Disease to risk factor study. Effect to cause study not associated with attributable risk, associated with antecedent causations. And the answer is associated with antecedent causation. So cohort study is a type of analytical or observational study. First of all, very important. This first point is very important. Analytical or observational study. Very important. Used for hypothesis testing, also called Trohock study, prospective forward-looking study, cost to effect study, exposure to outcome study, risk factor to disease study, incidence study, follow-up study. And all these names are important as well. So, strength of association or prospective study, that is cohort study, is given by relative risk, attributable risk, and population attributable risk, PAR. Relative risk is defined by incidence rate divided in incidence exposed divided by incidence among the non-exposed. Incidence exposed means incidence among the exposed group, and incidence divided by the incidence among the non-exposed group. Attributable risk, incidence among the exposed minus incidence among the non-exposed group divided by incidence among the exposed group into 100. Exposed to what? Exposed to either disease or to this whatever we are studying. Population attributable risk is population attributable risk. Incidence among the total minus incidence among the non-exposed group divided by incidence among the total into 100. We exposure or exposed, non-exposed, exposed to the agent or factors, and we draw this table, right? Disease, no disease. Exposed to some risk factors are like this. Disease, yes. Also, not yes. How many numbers? X, Y, A, B, whatever. We draw this 2 into 2 table, right? Classical example of cohort study is Framingham Heart study, which is an antecedent study. Other examples include Dawson Hills, which is an example of prospective study on smoking and lung cancer. You must remember these two examples. Okay, these formulas are given here. Same thing. And comparison between cohort study and case control study. Cohort study is time consuming while case control is less time consuming. Case control, in case control, what will be there? One will be the study group and another will be the control group. Nothing will be given basically to that group, and the drugs or anything is in question that will be given to the study group. Case control is relatively cheaper and it is expensive. Chance of loss of follow-up is high. Loss of follow-up, no loss of follow-up occurs. Not useful for rare disease, while useful for rare disease case control. It has ethical issues, no ethical issues. Because why expensive, time consuming, ethically having ethical issues for follow-up means the participant get lost. Why all this disadvantages are there? Because you need to give exposure, you need to cause the disease. So you cannot do on volunteers, basically. You need to go for somewhere, some institutions where already exposure, already patients are there who are exposed. And you need to then find out some exposed to the same risk factors, but disease has not happened. Then you need to find some individuals who are not exposed, but the same disease happened. All these all these things means exposed to the risk factors, disease also occurred, so they will you will get them in hospitals or any institutions. Then they were exposed to the risk factors but not disease, they never suffered from the disease. This type of individuals you need to find. Then you need to find again non-exposed people but have the same disease. You need to find those individuals. Again you need to find non-exposed and no disease. That is okay, fine, it's easier for finding, but that's why it becomes time consuming, expensive. But case control, you allot randomization, you employ randomization method to allot into study group and control group, and you do your study. Not so much time consuming or relatively cheaper than cohort. But cohort can calculate incidence and relative risk, while case control can calculate odds ratio. Cohort is also known as all these other names, and case controls also known as retrospective effective cost study, outcome to exposure study, case reference study. Okay, so for today, up to this, and we'll continue for more 2 classes. Okay, thank you for today.